Hello, my name is Michele Courton Brown, and I'm delighted to welcome you to Quality Interactions live discussion series, A Path Ahead, looking at equity and COVID-19. Today's discussion is on the pandemic's impact on mental health. And I'm joined today by my colleague and friend, Dr. Joseph Betancourt. Dr. Joseph Betancourt is the Chief Health Equity Officer at Mass General Brigham Health System, where he has led the equity and community engagement efforts around COVID since its launch in March of 2020. In addition to the work that he's doing at Mass General, which includes directing the Disparity Solution Center, Joe is a well-recognized and often sought-after speaker who's been on CNN and NPR, just to name a few. So Joe, delighted to have you again for discussion. Welcome.
Great to see you, Michele, and thank you all for tuning in for another discussion. We're really excited, and I'm back to my MGH role of equity and inclusion. We've, post the pandemic, stood down some of the MGB equity efforts that we were leading, particularly related to the pandemic. So, now we're heating up again. I think that's part of what our conversation will talk about. Obviously, a lot that we've done around structural equity and anti-racism that will soon be announced. So it's been a busy couple months, but it's a pleasure to be back and a pleasure to be talking again about another issue that's critical around equity and disparities to mental health.
Indeed. So why don't we start talking about where we left off? In June, when we ended our first live discussion series, we've seen a real surge here in Massachusetts and really around the country, and then some leveling off. But we've also seen some data, right, that 13% of African Americans comprise the population in this country. But the dramatic impact that COVID's had on our population of African Americans is pretty significant. So why don't we start there? Where are we today in the pandemic?
Yeah, Michele, I think, certainly here in Massachusetts, we saw our first surge, what people believe is part of one continuous surge, but the first surge level out, May into June. I think anybody who's followed the national news understands this is a state-by-state issue, and so there's a lot of variation on when people had their surges and the like. And so I think that's something that we know. This is the way this pandemic has impacted our country has been very uneven for a lot of reasons that you all certainly are aware of. Some of them very directly related to, statewide policies around mitigation of the spread of COVID. Here in Massachusetts now, after we've been able to level things off, we've had little small flares, really excellent surveillance like we see around the country, little small flares. We are seeing now a more steady uptick. It's not unique to us. We're seeing it in Europe. We're seeing it here in Massachusetts. We're seeing it across the country. I think I was just looking at the news last night, and I think we had no states in the green zone, which COVID cases heading down, a bunch in the orange, which are steady or slight increase, and then a bunch in the red. So we are seeing, and we are in the midst of an uptick. And so people ask then, why the uptick? And this is what we were fearing, which is as you head into colder weather, people are in spaces together. But I'd say it's a couple of key factors that lead to this uptick. One is the reopening. So we have certainly reopened. And when you reopen, those same essential workers that you described who are disproportionately minority and been disproportionately impacted are now more exposed as you have more people coming in as customers, more people coming in as co-workers. So reopening plays a role, and I think nationally we've tried to do it, and particularly here in Massachusetts, in a paced out way. But this is a numbers game. More people together, greater risk. I think when it was outside, it was better. Inside, more challenging. I think certainly there is fatigue to some degree with this. This is tiring, the mask wearing and the like, and we have seen some kind of relaxation of our kind of vigilance, particularly around getting together with family, around small celebrations and parties, which are incredibly important. So it's multifactorial, and I think the message we don't want is, particularly as it impacts communities of color, for it to be people are acting irresponsibly. Again, we are going to see this next surge likely be in the same places where the first surge hit, And so I would put in a plug clearly as we enter into this next phase. At a minimum, what you can do is get your flu shot. You need to continue to do all the things we've talked about: washing your hands, wearing a mask, social distancing, avoiding gatherings. But getting the flu shot now is another key part of that set of recommendations. So we hope people could do that. But this is tiring. Now we've been at this for a bunch of months, and we did see a light at the end of the tunnel through the summer, and now we're back. We're heading backwards a bit.
Sorry about that. You mentioned fatigue, right? And that is often related to stress. And I wonder if you could talk about that a little bit. I would just say, personally, I've had 3 sets of friends who've lost both parents to COVID in the last 3 or 4 months. So I know this issue of stress and how we're managing this mentally is pretty much on the forefront of a lot of people's minds.
Yeah, if we talk about mental health and stress in normal times, just in regular times, we know that mental health, like many of the chronic conditions we talk about routinely, disproportionately impact communities of color for a lot of different reasons. And some of them are, the social conditions. A large part is racism that we've talked about a lot. And a large part of it is inability to access mental health services. Mental health has been separated. The brain has been separated from the rest of the body in ways that don't make sense to a lot of people, and that hopefully we're coming back around. But if we think about in normal times, if we think about individuals' ability to, number one, be comfortable themselves with acknowledging that they have depression, as an example, or anxiety, or in the case that you're mentioning, even like PTSD, post-traumatic stress disorder from all that's transpired. There are 3 things that have become particular challenges around meeting the needs of communities of color around mental health in normal times, and those include certainly stigma. In my patients who I interact with, of which a large amount are Spanish speaking, I have to be very careful with the language I use. The cultural competence around discussing mental health is critical, and I think it's critical for all, but I would say maybe acutely critical for others for whom resilience and grit was really put forward as a way to manage any kind of emotional difficulty. And emotional difficulties are seen as weakness, not an acknowledgement that the brain is tied to the body, and it's not weak if you feel depressed. This is a condition just like diabetes, right? And so stigma is one that's incredibly important. And in normal times, that was very challenging. And so people were, didn't feel comfortable talking about it or seeking services. Number 2, if they wanted to seek services, it was often challenging. If you think about this community, perhaps working multiple jobs, this community having, transportation challenges, just if you got over the fact that you have stigma, getting somewhere was a challenge in and of itself, right? But because of time limitations and transportation, just as an example. And so that's barrier 2. And then number 3, when you get there, you've jumped through the first 2 hoops. You've agreed, you've gotten there, and then you are, in the exam room across from someone who doesn't look like you, doesn't speak your language, doesn't understand your journey. And we know that minorities are significantly underrepresented in the mental health workforce. So those are 3 very legitimate barriers that in normal times make just acknowledging and addressing mental health particularly challenging. And so this is all worse now. It's all terribly worse now.
So in what ways would you say it's worse?
Well, I think it's worse in a couple of different ways. A lot of the time, the way our community has been protected, and I say protected not in a positive way, but in a way in which they've tried to protect themselves through these difficult and challenging day-to-day circumstances in normal times, is through this idea of resilience, this idea of collective efficacy, this idea of social support, being in your church, being around your family, right? You find connection that gives you strength. Now, I'm not saying that that's an answer or a treatment for depression. I'm just saying that often buttresses the impact of depression, anxiety, and stress on an individual. What do we see now? We see all those things are limited, and they have been replaced with social isolation. People unable to see their families, individuals isolated. Those things that at least protected you from going deeper now have further been exacerbated, further removed. And I'd add to that not only have you removed your resiliencies, the things that give that are a buoy for you, but you've added to that everything that we're talking about with racism, the pandemic and how it's disproportionately impact our communities, and the worries about it impacting our communities going forward. Concern around just survival. I mean, what we see from the socioeconomic side in our economy, and concerns around evictions, around food insecurity, around domestic violence, around just having money to pay your bills, and not to mention the national political dialogue, which is incredibly divisive and difficult, the election, if you're undocumented immigration issues, you have insult upon insult upon insult upon previous injury, like we've talked about before, that makes mental health so acutely important, addressing mental health so acutely important now. And communities are asking for it. They are saying it. They're saying we are hurting, and this is the challenges that we face now.
So can you talk a bit about how these mental conditions manifest a little bit deeper? You talked about some of the issues that people are facing with PTSD and others.
Yep.
What are you seeing in terms of what I would almost describe as the perfect storm of mental health challenge? We are in the fall. We know seasonally that the fourth quarter, particularly around the holiday season, becomes a high period for suicides. And what do you talk a bit about that?
That's right. It's getting darker earlier. The holidays are always challenging for people, and they're going to be especially challenging when people are alone and they can't, get that strength. So I would say it manifests. We are seeing, and I see this with my patients, and we see it from what the data is telling us. We are seeing increases in four particular areas. Number one, and they're connected, but one is kind of PTSD, post-traumatic stress disorder. Given we were disproportionately impacted by COVID, we are more likely to have had, as you mentioned, a family member who has suffered in some way, and that is traumatic for us. That creates anxiety. That creates, quite frankly, a desire to go nowhere near a hospital for what that means to you at a time where we're telling people to come back, right? So the trauma that people are experiencing, not only those who've had family members, but those who actually had COVID, they're traumatized. They're trying to get back to work. They're trying to get their concentration right. They're trying to get their energy right. So PTSD is one, I believe, that's incredibly important, and we're seeing manifest. I'd add, Michele, that in today's current context, you can't be on Twitter, you can't be on any social media without seeing, at least 5 episodes of racism going viral a day. Who's the next person who's being outward and using the N-word, cursing somebody outright? That trauma is, so these traumatic events range from those that some people might consider micro, but they're not, to what other people would consider very significant in losing a family member or dealing with a very traumatic issue. I'd say the second is general anxiety. As I mentioned before, the anxiety is, if we think about hierarchy of needs, your first set of needs are roof over your head, food for you and your family, and safety. And all those things have been challenging, in this current environment. So if we think about those situations, that anxiety is real, and there's uncertainty around the election, around all those other factors that I've mentioned. So that anxiety is, and I see patients coming in saying, I'm just feeling more emotional, is what they might say, or I'm just feeling a lot of stress. They're not using the word anxiety or depression. And that leads me to the next one, which is depression. It has always been difficult for people within our communities to admit that they are depressed, right? Because it's seen as weakness. But you will see people saying, I just feel more irritable. I just feel more on edge. Me siento más triste. It's something that we're seeing every day, and there are words that are symptoms for depression. No puedo dormir tanto. I can't sleep as much as I used to. Me estoy levantando de noche. I'm waking up at night. And so those are all symptoms of depression. And so my challenge now is to have a conversation with them about, we are dealing with a lot of things that will decrease your ability to manage them and to address them. And so that's depression. And then the last one, Michele, incredible attention to substance use disorder prior to COVID, and what we are seeing by way of the growth in the use of substances, which you would understand because people are turning to substances to ease their pain. People who, were sober due to all the stress are going backwards. Our ability to keep people in treatment is more limited in the presence of COVID. So PTSD, anxiety, depression, substance use disorder, all on the rise, and all require acute attention, generally and specifically for communities of color.
That's a lot. That's an awful lot, Jim. So, from your clinical chair, what can be done? What can our colleagues do to support this mental health issue?
Yeah, I mean, I think there's a lot of things that we need to pay attention to here. And one is the data. And certainly for me as a practicing clinician, it's the data that I get every day when I speak to my patients, right? So we need to have an acutely sensitized radar and awareness for the subtle ways in which people might message any of these mental health conditions that I have expressed here and articulated, so that we can be able to respond to them. People may not put it on the table for us. I am depressed. I am anxious. Instead we are hearing. What am I hearing? I'm feeling like I'm having palpitations. I'm feeling like I'm a little short of breath. People are anxious about getting COVID still, but the words that they use, and this is a key part of what we've been teaching all these years, right? Our cross-cultural skills are about getting at the explanatory model, getting at, if somebody comes to you and says, well, I'm having more palpitations, I might be tempted to ask the standard questions. Do you have, and I do, but to clear myself, but the standard questions are, do you have chest pain? Do you have shortness of breath? Are you dizzy? Those are things that are related to palpitations. But when I hear no, as opposed to just jumping towards a cardiac test, I might step back and say, what do you think are causing your palpitations? At which point I'm hearing people routinely say, well, when I think about everything that's going on, my heart starts to race. Now I know it's anxiety. When they talk about shortness of breath, and I go through my series of questions and everything's negative, and then I pivot to, what do you think is going on? And then they say, well, when I think about these things, I start to breathe fast, hyperventilation. Our capacity to be aware of the subtle ways in which people will mention these mental health manifestations, the conditions that I've laid out here, is critical. And so having that awareness, having that on our radar screen, and then investing both at the system level and at the provider level around these is going to be critical. So what are systems and providers need to do? I talked about stigma. We need to say, hey, everyone, hey, world, hey, communities of color, we are facing it right now. It's okay if you're not right. It's okay if you're not well. We want to figure out a way to help you. So number one, destigmatize. If ever there was a time in history where we could really normalize depression and anxiety and trauma, it's now, given everything I mentioned. So that's one. I'd say another one is we really need to think about ways in which we can make care more accessible, mental health care more accessible. Now, virtual has been amazing, right? Because I'm able to connect with patients. We address the social determinants through virtual, and you could argue we address stigma through virtual because, you could be in the comfort of your home. You don't need to be in the office of a therapist. And so nobody needs to know that you're talking to a mental health provider, right? So ways in which we can make care more accessible is important. Now, our path of virtual has been very effective. That being said, the digital divide is limiting that. So I would say we need to push hard on making care more accessible and making sure that virtual care is equitable, because for mental health, I would argue it's most important. And then I guess the third is we need to absolutely leverage diversity of mental health professionals. The beauty of virtual is that with the appropriate networks, I could have a patient of mine speak to a mental health provider in Arizona who speaks Spanish, or Florida, or Puerto Rico, if the appropriate systems are built. So we need to think about innovative and disruptive strategies to address the limitations that we have in the diversity of our mental health providers through virtual, and being able to leverage different markets that have more access. I'll end by saying that providers need to understand that what we're facing with mental health, it's an epidemic within a pandemic, and it will take a toll. They need to identify it, discuss it, address it. We need to provide resources, and I would say that a lot again of what we're talking about and what we have talked about over the years around these key tools and how we deploy a cross-cultural approach to mental health and a framework to that is really critical. Now more than ever, those tools are important at the bedside, at the community level, and at the system level. I'm yapping a lot today. I'm sorry, Michelle.
No, no,
I
there's
care deeply
a lot
about this, and I have so much so much to say
there's
about it.
a lot to be said about this, and you really elevate the. If there's any silver lining, it's hard to think of a silver lining in this COVID crisis. Has been the adoption of digital health and this opportunity to have more equitable healthcare. But as you said, without this cultural competency lens, it would be a challenge phenomenon, right? Um, is there anything else that you want to share? I mean, you've really been in the trenches for the last 9 months on this, and I think that you always have so many sort of pearls of wisdom to share and stories from the field that really, I think, help concretize for us what the experience is in the hospital setting. So I just wonder if you have any other insights you want to share from that approach.
No, I appreciate it. I mean, I think, some of the other things that we're thinking of, I think I've talked here before about our community-based approach to mitigating the spread of COVID. One thing we were doing was care kits, right, where we deliver door to door at our food pantries at our health centers, kits that basically was a bag with a couple of masks, some hand sanitizer, information in multiple languages. We are now including more information on mental health in those deliveries, understanding that. I think clearly leveraging trusted messengers to deliver the messages that I talked about are things that we're trying to do. It's people want to really hear these very sensitive messages from people who look like them and understand them, and maybe share some of that experience. Just is what it is, and that's a human phenomenon, not a minority phenomenon, not any phenomenon. I think that that similarity breeds trust to some degree. So I think leveraging that is something that we're thinking about. And just say, as a provider community, there are incredible resources that are out there right now that we need to be aware of. I do believe that as we think about a learning pathway or portfolio of educational activities that we need to engage in, the ones we're focusing on certainly are racism, bystander training, microaggressions. But we need to pivot to also understand how important mental health is and training around mental health, because that is acute. That is something that we're facing in this moment. And the appropriate set of tools and skills to manage that is going to be critical. When I have a patient come in, and I see them, and the next time I'm going to see them is 3 or 4 months, if I miss the opportunity, Michelle, to pick up on some of the things I've talked about, that's 4 months lost. Now, what happens in those 4 months? Deeper depression, increased suicide risk, greater anxiety, inability to go to work. So every minute counts as we think about the precious moments we have engaging our patients. And so the quicker and more efficient we can be around mental health, adding the importance of being compassionate, I think time is of the essence as we think about mental health in this kind of epidemic within a pandemic. This will only get worse as it gets darker, as it as we see how the election transpires, as the COVID numbers get worse. This will get worse. I say it now with clarity and with certainty. And so from a prevention standpoint, it was bad before, made worse by COVID. It's going to get worse. We need to act soon, swiftly, and put resources behind it.
Indeed, indeed. We're coming close to the 12:30 hour, and I want to be respectful of the time of our colleagues. Joe, I appreciate your insights and your willingness to share so generously about the experience that you're having, and that's really been have across the country. That there, people around the Midwest are being challenged right now. Their numbers are up. I think it's just really important that we continue to focus on this issue of cultural competency and how we meet the needs of all diverse patient populations. We have this conversation today. Shortly, we'll have 2 additional conversations. One will be on immunization, and there'll be a more fulsome update on COVID as we continue to march through the next couple of weeks and months. So we look forward to having you engage again with us, Joe. Just ask if there's any last comment you want to make before the 12:30 hour.
Yeah, I just say I'm excited to be part of these conversations again with you, Michelle. I think we can't communicate enough. We can't create community enough. Things that we're learning amongst ourselves sharing them and bringing them to scale is really important. I mean, I share these things with humility, but a lot of passion, a lot of dedication. And so, there's been people, I'll just say this, may I'll end with this. There's been people who know so much more about these issues than I do. And so when I say I speak to, with humility, as a primary care doctor, I do address mental health, but I think this is a time to really, lean on those people who've made careers around this. They deserve our attention. They deserve our ear. And those resources are out there, and we need to honor all their work and really understand that the types of things I'm sharing are really built on their shoulders. And we need to, like we've talked about, move with urgency. This as we head into this next phase, this will not only potentially cost us lives as it relates to COVID, but mental health will have an impact if we're not aggressive and in there and trying to build community. So I wish everybody good luck. I hope this was helpful. Enjoy our conversations always, Michele. Look forward to our next couple. And I'll end by saying we need to take care of ourselves too. We are grinding here, and our own mental health, wellness, and well-being is essential. And so find your thing and do those that one or two or three things. But this is a kind of a war, not just one or two battles. And keeping ourselves healthy is really important because you can't help people if you're not well yourself. And it's hard to care if you don't feel cared for. So that's the other plug I'd make, is make sure we're all taking care of ourselves.
It's a great way to end. Thank you so much, Joe. And thank you for joining us for this live discussion. Have a good day.
Thanks, everyone.